hygiene. No, sorry. Bad joke. All right. So, everybody here, I hope, practices good good hygiene. Hopefully. I haven't walked by anybody and been like, well, damn. So that's good. All right. But we need to, of course, make sure that um, with hygiene, our patients are all able to do all of their ADLs, that lovely mnemonic, batted, okay? Bathing, ambulation, toileting, transfers, eating, and dressing, okay? With grooming, specifically, it helps to promote better comfort, better health. People feel comfortable. I don't know about y'all, but after I've taken a bath or a shower, I'm like, okay, I can just go to bed now, right? It improves self-image. Nobody likes being dirty, per se, if they have a choice. You know what I mean? Some people might not have the same standards of cleanliness as others, but in general, people don't like being dirty, okay? There's a decreased chance of infection and disease, and better for social interaction, because I'm sure we've all had experiences where we can definitely tell that somebody did not brush their teeth that morning, and we are like, okay, well, later on, right? Or don't say hi to me right now. All right. Now, sometimes, especially with the elderly, we're going to run into clients that need assistance with all of these things. They might need help bathing, getting their back, or their undercarriage, if you will, okay? Or maybe they can't bend over and get their feet safely. You know, they might have to have a chair in the shower stall, okay? Or what I have always liked is giving, and you see a lot in long-term care facilities, they'll have a shower wand. I think that's the proper term for it, where they can shower themselves and do everything that they can, and then you just get what they can't reach. Fantastic. Okay. Ambulation, there's things that we help with that as well, as far as, you know, being able to stand up appropriately in the bathtub to take a shower. All right. Or from going from a chair to the shower. Toileting, yes, you may have to clean up people who have either soiled themselves with urine or feces, or after they've used the toilet. Okay. All right. Our role is to assess their abilities to perform those by themselves, whether it's independent, +1 assist, +2 assist, or completely dependent. Those are the main 4 levels of assist that we can provide. Okay. Independent is just like it sounds. They can do that activity by themselves. They don't have any assistance needed. Okay. A 1-person assist with eating might be that maybe we have to cut the food up to where that they can just stab it with a fork and feed themselves. But they don't have the dexterity to do the cutting. Okay. Or we might have to do it to where they have arthritis in their hands and they need those extra large grips on the silverware. Okay. They've even got some now for Parkinson's disease patients, because with Parkinson's they get a lot of tremors like this. So imagine trying to eat peas or corn like this. Well, now they used to have it with just a hinge on like a fork or a spoon, and would allow for them to do that. But now they've got it with magnets and things to where as the patient progresses with it, they can adjust it to the amount of tremor and things. It makes it a lot easier for the patient to do it on their own. Again, always promoting self-care, so that's always promoting independence, allowing them to do as much for themselves for as long as possible. Okay. I need to stop putting it in the wrong pocket. Keep grabbing my keys instead. Yeah, but I don't want to go like that quick. All right. Now, delegating appropriate parts of hygiene care. Who can we delegate this to? UAP, or unlicensed assistive personnel. So the nursing assistant, licensed caregivers, those types of things. Okay. Even the LPN, we can delegate it to if we have to. All right. Does that mean we don't do it at all? Nope. Okay? You are required, as a nurse, need to be able to wipe a butt and empty a urinal and all those fun things. Okay? All right. We need to make sure that before we delegate any type of hygienic care, actually, before we delegate anything to somebody that is not a fellow RN, that they have a good understanding of what is expected of them. Okay? When we say, Mrs. Jones needs help with a bath, all right, do we know that that person knows exactly what needs to occur? Not always. Okay? I have worked with some nursing assistants out there that you're just, how did you pass the exam? And then I've worked with some with, it's like, are you sure you're just an NA and not a nurse? I mean, it goes the full gamut. Okay? Again, they have to make sure that they are aware of the amount of assistance that's needed and if the patient uses any assistive devices. We have so many different assistive devices out there. We have walkers, we have wheelchairs, we have things to help patients who have maybe have lower back pain to put their socks on without having to bend over. Okay? Presence of care in tubes, anything that we put in the body or on the body, we need to be careful with. Okay? Yes, peripheral IVs, which are the ones that you guys are probably most familiar with if you've ever been into the ER or anything, they give you an IV. Typically goes in your arm or in the back of your hand. But sometimes you might have a patient who has a central line, and it goes from here all the way up the arm and ends up at the end just before the heart. You don't want to pull that out because it's not so easy to put back in. Okay? So being aware of those things. Catheters, I have had confused patients that have taken them out with the balloon intact, and the balloon is about the size of a quarter. Okay? And I have had nursing assistants that have done that with a patient. So be very cognizant of that as well. Observations to make. I've already told you, best time to do what kind of an assessment? Skin assessment during the bath. Okay? Personal preferences as well. How many of you guys love to have a shower first thing in the morning when you're waking up? I am not that person because it makes me sleepy. So when do you think I like to take my bath or my shower? At night before bed. Okay? Some people, for you morning people, it probably hypes you up, but that's what my coffee's for. Okay? We do try to accommodate that. Now, it doesn't always happen. Because typically when you go into the long-term care facilities, they're going to have a bath schedule dependent on, sometimes it's based off of what room number and what bed number they're in that room. So they might do all the evens, depending on how many patients, all the even-numbered rooms, like room 2, room 4, room 8, and room 12. They might do them on Monday and Thursdays. And they might do the other ones, on Tuesdays and Fridays or whatnot. So, and it might be in the morning or it might be at night, just depends. So if they can accommodate it, great. If not, they have a schedule. Okay. Cultural and religious beliefs regarding hygiene and cleanliness, be aware, especially it's more difficult for us guys. And granted, we don't have a very large Jewish population here in Arizona. We typically have more Mormon and not Catholic, but Christian belief systems out here. But there are some out there that absolutely prohibits receiving any type of personal care from somebody of the opposite sex. Now, us guys, we tend to run into that more. But ladies, if you go to New York, where there is a large Jewish population, you might run into that with a male patient. Okay. Some other things that might affect someone's understanding of hygiene and self-care practices: economic status. They might not have access to, running water even. We used to have over here there's a cemetery right over here, but there used to be at the base of this mountain quite a few homeless people and homeless camps and stuff. And so, where are they bathing? They're probably not. Okay, if they're lucky, they might be able to go to a shelter. Okay, truckers who are driving out in the middle of nowhere, they have those truck stops that they can go to. Okay, that's great, but that's like what, 40 miles away from most civilization. How many public toilets and stuff around in this area do we have that have showers in them? We don't. Okay, there was, I think it was after Katrina, there was a mobile bathing station that was put up for all of the those that were like not dislocated. What's the term I'm looking for? Relocated from like the what is it? The Superdome or whatever it was down there, because they didn't have the bathing facilities there either. And somebody came in with these trailers that were just basically showers for everybody, so that way they could take a shower at least. I have had a student who, after he graduated high school, worked for a mobile shower. He would go around to different houses and help the elderly that lived there with their showers because they didn't have any family or anything to help them. So, knowledge level, we tend to forget that flossing is very important because we're always talking about brushing your teeth, brushing your teeth, brushing your teeth. We tend to forget flossing mainly because a lot of our patients have what? Dentures, so they don't need to worry about flossing. But a lot of the stuff that we're going over applies to all of you guys. Getting enough sleep. That's always the case, okay? And I covered this last week in lab as far as in the importance of pericare for a female patient is always front to back. Okay, we don't want to bring dirty to clean because then there's a whole other set of issues there. Okay, there are a lot of other factors when it comes to like health statuses with the elderly. You've got cognitive impairments, dementia patients, and Alzheimer's patients, for whatever reason, are petrified of water. They become extremely hydrophobic. So you have to be aware of that. And how would you adjust your care for somebody that you can't take into the shower room because they, freak out on you? Or they, you've got there used to be an old joke, that, grandma refuses to take a bath all week, but then complains to the family that she hasn't been given a bath. Okay? But when you think of bath, that doesn't necessarily mean that they have to go into the shower room and get doused with water. Okay? This is not the Shawshank Redemption with the hose and everything, although sometimes it may be easier. But you can do a partial bath. You can do a bed bath, just to get them presentable at least, okay, so that they don't get that buildup of body odor, okay. I had a patient at the nursing home I worked at. She was, at that time, like 96, so this was like 20-some years ago. I very well doubt she's still there. But her and her sisters survived the Titanic. Right? And so she had Alzheimer's, so she was really petrified of water. So, yeah, the entire time, she knew what was coming because, we take them into the room in their wheelchair, and we transfer them over to the shower chair, and that's when she would just start wailing at the top of her lungs. And that facility was shower only, so we had to take her into the shower. And so she would wail from the time we sat her into the shower chair, wheeled her down to the shower room. The entire time we're showering her, mind you, it's tile, so it's reverberating even louder. And then until we put her back in her room and we were drying her off, then she would stop. In long-term care, typically not. Typically not. There are certain medications with the elderly you have to be super careful of. And just as a future reference, it's called the Beers List. Yes, beer, like B-E-E-R, but it's not about the newest IPAs, so let me tell you. But it's all these medications that we as healthcare workers have to be extremely careful with with the elderly because they're not going to excrete things or filter things as fast, and so they have a higher likelihood of overdosing easily on them. So that's one reason why. Now, we could have just, put a blindfold on her, but then, exactly. So, yeah. I learned to pack earplugs with me when I was working, or I would try to avoid the days that it was her bath day. So emotional disturbances, you might have depressed patients. So for those of you that maybe not now, but when you get to psych and mental health, and sometimes in the hospital too, okay, patients when they get a terminal illness, they're not always, doing backflips about it. So there might be some issues there. If anybody's ever felt down and you just don't want to move, you just want to stay in your bed where you're comfortable, nobody's bothering you, the lights are all shut off, all that fun stuff. Bathing is like the farthest thing from being a concern. So, pain, of course, when we're in pain, we don't want to move or we don't want to do anything. Might restrict our mobility a little bit. I was having shoulder issues earlier this summer, and it was really hard to wash my back because I couldn't do this with the washcloth. So I was only getting to about right here. And so finally went to the doctor and got all that taken care of, but now I'm able to wash my back now. Limited mobility, decreased range of motion, weakness. You may have a patient who is ordered by the physician to be on strict bed rest. Okay, we do make shower beds. They're basically PVC pipe beds with instead of a mattress, it's kind of got like a tarp thing so that it's easy to dry off, water rolls right off of it, all that fun stuff, but we put the patient on that, wheel them into the shower room if necessary. But typically they'll get a full bed bath instead. Sensory deficits, this is why you have to be very careful with the temperature of the water that you use when you are cleaning somebody, okay? Because again, we have that nice extra fatty layer at this stage of our lives that the elderly don't. So it might not be very warm to us by any means, but to them it could be scalding, okay? Typically what I recommend you do, if they're able to, have them dip their fingers in it to see if it's too hot or too cold for them, okay? If they're not able to, use your best judgment. Some places have bath thermometers that you put in the basin as you're filling it up and let you know if it's too hot, okay? Visual deficits, how could we combat this with our patients? Make a routine, but if, tell them what you're doing as you're doing it beforehand. Now, let's say that Shauna here is blind, okay, but she's still able to move all of her extremities and stuff, okay, but she may have a hard time finding the washcloth or the soap or whatnot. So what can we do for her? Huh? Have it ready for her and be like, here's a wet dog. Go at it. Here's your washcloth. Here's your soap. Right? That's still promoting independence. It's not being lazy on our part. Okay? It might seem that way, but again, if you don't use something, what happens? You lose it. Okay? All right. Special considerations. My favorite character ever, Miss Sophia. Clients with dementia, they might argue with you. I just had a shower yesterday. No, you didn't, because it wasn't documented. This is where if it's not documented, it never happened. Okay, so they might get argumentative with you and upset, but you know what you do? Come back later. They'll have more than likely forgot about it, and they might have a completely different outlook. It really depends on your timing with them, okay? A lot of times, too, patients with dementia, in the afternoon, right around 5, 6 o'clock, anybody know what they tend to do? Sundowning, okay? They can either become a little bit more compliant or they can become a little bit more distracted and more combative. So I always try, when I was working PMs, which is 3 to 11, I always tried to get my baths done before dinner, because then people started sundowning and stuff, and they'd need to go, be medicated and put down. Not put down like, okay, she had a good run, but put to bed. All right. Clients with obesity. We talked about this yesterday a little bit in lab, or last week, where you have to check the skin folds for hygiene. I found a remote control. Professor Reed found a sandwich in a patient's fold. So it is, and you'll find a whole lot of other things too. Okay. And then of course an older adult client. One of the things I used to run into all the time was with the elderly females was, well, you can't help me with the bath. I don't know you. You're not my husband. You're not my, whatever. Okay. Not a huge big deal. What do I need to do? Get the female to either go in with me or trade out a patient for her with them. Okay. Goodbye. There we go. Okay. Let's take a break.